ॐ शङ्खं चक्रं जलौकां दधदमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिहृद्यां शुक परिविलसन्मौलिमम्भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गम् कटितटविलसच्चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिं तं निखिलगदवनप्रौढदावाग्निः.
Respected chairpersons, my seniors, and my guru who is officially present here, Dr. K. K. Dwivedi sir, and heartily welcome to my mother who is also present here. My topic is management of ankylosing spondylitis through Ayurvedic medicine along with agnikarma, a case study. Actually, this is very rare disease, and the patient came in my clinic, so I tried to handle the case, and I got wonderful results on that. So I am sharing my knowledge in front of you. Oftenly, this is single case study, as it is my initial work as my UG scholar, and I am requesting you all seniors and my friends, please start research work on this, especially AS. Coming to the introduction part, as all of you know, this ankylosing spondylitis is serodegenerative inflammatory disease. This is unknown etiology characterized by inflammation in the axial skeleton, especially SI joint, principally affecting young males in the third decade. Cause of the disease is said to be one of the restlessness and progression with period of exacerbation and remission. In Ayurveda, I tried to correlate it as Jina Amvata, because maximum symptoms of ankylosing spondylitis I found that Jina Amvata, because in that case Ama Pachan condition occurs. No need to go in deep because all of you know about that. Coming to the etiology point, and male and female ratio is 3:1, and the whole world population, even in 10,000 people, only 6 are getting as ankylosing spondylitis. But now it is increasing due to taking regularly pathya apathya, mainly following the apathya and junk foods. Come to the Hetu and Purva Rupa. In mainly I found that Purva Rupa, Jwara and Jadita is a main in AS. Coming to the Rupa, the clinical features, the Anga Vaikalya, Sankocha, Sandhi Jadita is compared to ankylosis. Egg in buttocks, Katishula, Asti Shushirta, Sandhi Shunyata, Sandhi Shodha, and improvement with exercise. Means the patient gets improvement with exercise. Coming to Samprapti, was similarly like Amvata, and you can see in the figure how the process of ankylosing spondylitis has been occurred up to the normal spine from fusion. Now coming to the case report, the patient was railway driver, and basically from Madhya Pradesh, it is Jangal Desh, and then my patient was pure Koshti especially. In that the dosha involved Vata Vradhi, Pitta Vradhi, Kapha Vradhi. In that Vata Vradhi, pain and magnesia, body ache, and Pitta Vradhi, thirst and mild fever, and the patient when having Kapha Vradhi in joint fusion and stiffness, abnormal tenderness, alasya, anorexia, aruchi, solemnness and insomnia. And the dosha involved are Agni, Rasa, Asti, Majja, Purisha, Udakvah Srotas and Rasavah Srotas. When the patient came in my clinic, I got in further investigations. Actually, it was pre-diagnostic case. Came to the Nagpur, and the doctor, allopathic physicians were told this is incurable, and hopefully your condition will be worse in future. Then I go through normal lab reports. Then I got these reports. Then coming to the treatment part, what I did, I had given the combination of Ekangvi Ras, समीर पन्नग रस, प्रवाल पंचामृत रस, बृहदवाद चिंतामणि रस, मकरध्वज, रुचि सत्व, महायोगराज गुगुलू, and Soothsaker. The combination of all Rashaushadhis with the dose of 1.15 gram BD for 1 month. This is 5 gram, 5 gram. This totally I have calculated for 1 month, and I had given 4 months of treatment. Then the reports are in front of you in next. Include of internal medicine, Rajna Saptapat, BD regularly, Vasinghanada Gugulu, 2 TDS, and Swadishta Virachan Churna. Actually, this is a reference from Rasantra Saryam Siddha Prayog Sangrah, and often used for Sadhya Virachan, which I used. And this treatment, the patient was follow up to 1 month, every 1 month, and I have given approximately same medicines. And up to 8/11/2001, after that I have go on reports, and this is the external applications which I did. Abhyanga with lukewarm water, with Mahavishagarbha Tela, Nadi Sweda, Dashamula Pat, and every 7 days of gapping I followed agnikarma, the special treatment which I found for ankylosing spondylitis. This is the diet chart, and now coming to the procedure of agnikarma, which I selected for patient, the Purva karma, Pradhana karma and Paschata karma. See, in first picture you can see material for agnikarma, and in second picture you can see the marking done on affected site of pain. I chose in X-ray. In X-ray reports, the first criteria of choosing the marking point is maximum site of pain, and neglecting of marma, second one, and third one is we should not touch the nerve junctions. This is the criteria of marking done on affected part of agnikarma. And this is the picture, Loha Shalaka made up to red hot. Agnikarma performed by red hot Shalaka. This is the in SI joint up to the L4, L5 region. I am doing agnikarma here. Application of Kumari Haridra immediately after agnikarma. Then the scar will not burn. After 6 days, the vrana become healed. And periodically I did agnikarma, and I got the result. The pain, lumbar region has been reduced significantly, inflammation has been reduced significantly, and movement of joint is better condition. After doing the 6-month course of agnikarma, action of agnikarma is first one is Vatahara, second one is peripheral nerve stimulation as per research of Jamnagar University, and reduces pain by nerve ending blocking. Come to the discussion part. Comparison of investigations between before and after treatment. This was the HLA-B27. It was positive on the patient, and after the treatment, after 6 months of treatment, when I go through and reports, I got wonderful result and amazing. Actually, I was not expecting that the HLA-B27 turns to in negative condition. This was the reports. LDH value turns to normal also, 624/1, and see in the after reports LDH also turns to normal. Before X-ray, you can see in the X-ray the fusion of L4, L5 just starting, because the patient was suffering from ankylosing spondylitis, diagnosed before 8 months ago, and he came after 8 months from me. Then the mild conjunctivitis only the seen with AS, rest of cardiac features and other features did not seen. And in this fusion you can see in before X-ray and after the treatment. See, this is a normal spine. Actually second X-ray is not clear, and you can see in direct view that it is normal scale. And SI joint is normal in that. And after 6 months of treatment, I go through an LFT because Rashoshadis I continued for 6 months, and I got one LFT report when openly is approach to normal. No abnormality has been detected in AS. And along with Ayurvedic Rashoshadis, we told to be heavy metals. It is not heavy metals. It is Rasayana property. And in discussion as per this case, the approach of Ayurveda in AS has been shown. The mutagenic effect found in this case with herbomineral combination of medicines along with agnikarma results to the cure of AS reference to Amavata. We can see actually I cannot giving the hypothesis, just I thought that the back mutation takes place in the ERAP1 which is responsible for AS gene, and according to modern genetics which is responsible for causing the AS. I am trying to say that it is a new hope with science of Ayurveda with modern genetics, because till not International Ankylosing Spondylitis Society, till not they have declared that till 2012 there is no cure of ankylosing spondylitis in any science. They have told in any science, and in future within 5-6 years by the stem cell therapy we will try to find out exact gene which is being acting behind the ankylosing spondylitis, and they had not told for treatment of that. No adverse features were reported during the treatment. Fusion of joints also removed as shown in radiological reports. Further, detailed clinical research studies are required to draw a final conclusion about the mode of action of the drugs. Results ये आपके सामने है. Patient number vertebrae and sacroiliac joint swelling showed average reduction. Patient number pain was reduced, and morning stiffness improved greatly. Patient has no longer complaint of morning stiffness. Patient has satisfactory passage of bowels. Patient was fresh for longer period. His appetite for short marked improvement. And HLA-B27 turns to negative range. Fusion also has been removed as you have shown. And the conclusion is we should not neglect in Ayurveda in any type of disease. I got the new concept to treating genetic disorders without the gene therapy with concept of Ayurvedic medicine comparison with modern genetics. It is a new hope. So I am requesting you, our seniors and great doctors, please start the research work on that, and we will get the better results in ankylosing spondylitis. Thank you.